The article that I chose for my scavenger hunt assignment is Music in the Treatment of Neurological Language and Speech Disorders. The introduction of the article talks about how music structures and language structures have many similar features. It also talks about the sophisticated techniques that have been developed to study just how music and language function directly in the brain. So, for example, scientists are using functional magnetic resonance imaging techniques to help highlight what areas of the brain are being affected when music is involved and when language is involved. The literature review section of this article talked about the multiple researchers throughout the decades that have actually recorded data about stroke patients who were barely able to speak but could sing, especially songs that they had learned prior to their neurological impairment. It also talked about a few of the different types of music therapy that have been developed and are being used. For example, melodic intonation therapy, which is where a person is taught to speak utilizing two different notes, a high and a low note, and then two types of rhythms, long and short rhythms. Now, the entire point of the article is that it actually studies the existing literature that is currently able to be found on the effect of music as a treatment. So the methodology that they use in this article is they created a set of specific terms that they inputted into databases such as PubMed or Embase and PsycInfo. They systematically removed all of the duplicate articles that came from the different databases and then judged the remaining articles on how they contributed to particular research questions that had been raised. Once all of the inputting had been done into the databases, there was a total of 1,250 articles that were found. Unfortunately, 94% of them were excluded because they didn't include a therapy study or they didn't include a participant group with speech disorders that were neurologically based. Another 60 articles were also dropped, mostly because they did not include a controlled measure that was accurate in showing how musical therapy had actually aided the patients in the study. So there are 15 studies total that were used, a total of 583 patients overall that were looked at and reviewed for this article. What they found was that there is a lot of information out there on music and language, but not all of it is usable. The usable studies that they did find showed that the treatments involving musical elements had very measurable improvements in their patients. However, it also showed that the quality of the methodology being used in the studies was very, very low, and that the observed brain activities that they were hoping would help solidify their theories were very contradictory. What the authors found in this article is that there are frequent gaps in the descriptions of patient characteristics that were provided in the studies. For example, education wasn't really mentioned and a patient's musical background wasn't included. These are a couple of factors that could definitely alter the results because if a patient has a musical background, they're obviously going to be more inclined to respond to music. They also found that most studies, all but one, focused on stroke victims. That kind of leaves an open area for other researchers. They can start to explore how musical therapy affects patients that have other acquired brain injuries. The authors also found that in general, the musical elements of melody and rhythm were what was primarily used in therapy. There wasn't really any mention of dynamics and tempo and how those could be incorporated into therapy sessions as well. And the last thing that they really discussed was that there is a large difficulty in being able to prove just how effective music therapy is, because the research in all of these aspects is still in its early stages. So while it's great that there's been reported improvement in a lot of the patients of these studies where music therapy was a part of their treatment, there's still so much room for advanced methodology to be used, incorporating better measures of actual proof of how music therapy is helping these patients, and hopefully it'll lead to less contradictory material and a little bit more solid evidence for everybody.